Welcome in Leuven, one of the main cities in the Benelux CLC, comprising Holland, Belgium, Luxembourg and Israel. Today we have a lot of guests around the table with knowledge, experience and know-how in the digital health area, where we as EIT Health will grow considerably in the forthcoming years. We hope to achieve new insights in this important and exciting area and new steps forward in bringing EIT Health on top of Europe and bringing the partners from the Benelux in a lead in Europe in this area.
The innovation pathway is really the process that companies are going through from the ideation phase all the way up to adoption. The development part that is in between. Few challenges around that are how to include patients, doctors in this innovation pathway, how to overcome the valley of death, as they call it, once you have your product ready for market, and looking at it from an investor perspective, how can we progress towards the adoption and scalability phase. I think the innovation pathway as a startup, especially in healthcare, is challenging. So any support that startups can get, or being an EIT organization or an accelerator in that domain, would be very helpful.
The innovation pathway in Belgium has a very healthy starting point, meaning there's a lot of entrepreneur activity to get innovation going. Where I think we can improve is connect the innovation to the real world needs and problems they're trying to address.
To improve the innovation pathway, I think, there's a need for training. People should be aware of the regulatory needs from the start when you develop a new product. There's also the developers themselves should understand the regulatory needs, and also the regulatory officers and experts should be trained in understanding what the new technologies bring.
There are many hurdles one could identify, but I think one of the most important ones is that there is a lack of what I call attractive business models, and how the public-private partnerships and the way it works can improve. So it creates a win-win situation for everyone, but at the same time also keeps focus on benefit for the European citizen. How do we bring it to the advantage of the European system at a reasonable price, but at the same time maintain quality of the products we have, so that we at least provide something that is of value for the European citizen here. And EIT Health, for me as a platform, can actually play a quite important role in translating that message and bring it also not only to the public, but also to the political people out there.